Perfect.
Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. My guest today is Dr. Maria Rimmerman. We're going to learn all about her. We found out yesterday she lives in Esselstyn country, so maybe she has a story or two about them. Please welcome her to the show. I had no idea yesterday when I was announcing you that you guys were neighbors.
Thank you. Yes. We've known them for quite a while, and I guess I hadn't planned to start my story this way, but I'll start talking about them because they've been such a blessing in our lives and in our plant-based journey. And my husband is a cardiologist at the Cleveland Clinic and has worked with Dr. Esselstyn, sharing patients over the years. And my daughter's a competitive swimmer, as Jane Esselstyn's children are all competitive swimmers as well. They went to the same school. They swam on the same team. We knew they were plant-based, but they're not, they're very committed, but they're not preachy. And so, if you want the information from them, they'll give it to you, but they're not going to shove it down your throats, which, was great for us. But then the year after our daughter finished college in 2015, she helped recipe tests for the Engine 2 cookbook with Jane Esselstyn. And that's how we became plant-based from that. And so really, they were instrumental in my wellness journey, in our health journey, and in changing and transforming our family. And so, we owe a lot to them. And yes, they're neighbors. We see them in the grocery store. Their carts are always filled with kale and greens of all sorts. And so, they really do walk the talk, and we're completely indebted to them for all they've shown us.
It's wonderful. I had no idea. Now, when you look in their cart, is there ever any contraband?
Never. Never. No, they're really the real deal. So, again, we wouldn't be where we are today if it weren't for them. And Chef AJ, for you too. And I keep my little, if you look at my book, it's dog-eared. It's very well worn. So, the title of what we're talking about today is how to attain and maintain a lean body without struggle. And I have to say, Chef AJ, you, for me, have been that person because, there are a lot of plant-based people out there, more and more now. But I needed someone for me, in addition to the Esselstyn's message, but I needed someone that I could really identify with, who had been through that struggle of trying to lose weight, trying to figure out a way without deprivation, and being able to attain and maintain weight loss easily. And that person was you. And some of your, messages or some of your tips and hints in the book are what have enabled me to be where I am today. And, I guess I'll start with the punchline first, because you see me now and you don't know where I started, but, thanks to a whole food, plant-based way of living, both inspired by the Esselstyns and by you and other plant-based people, Chef AJ. And I will say, I still call myself plant-based, but I am plant exclusive. And that's a newer term that's coming around now. Most conventionally, we're still calling ourselves plant-based because people understand what that means, as distinct from vegan even. But thanks to this way of living, I've lost and maintained a weight loss of more than 70 pounds. And I'm only 5'1.5". So that's a lot of weight. And this is not comfortable for me to be here in public like this, to tell my story, because somehow I really thought my issue was private, even though being as big as I was, how was that private? But I really feel the need when I go out in any public place. I realize that we are killing ourselves with the standard American diet, and we need as many people as possible. Chef AJ, you have done this in a tremendous way with your books and your videos to get the message out that there's another way of wellness. And, I'm committed to helping people see that there is another way. So, I think I'm, in addition to, spilling the beans about how much weight I've lost, I'll show a few pictures. And, you said I could share my screen. So I'll start with.
I just want you to know that your neighbor Jane Esselstyn is watching. She says she's very happy to see you here. You know what I wanted to ask you though? Did you know them more from being doctors at the Cleveland Clinic rather than being neighbors? Or I have a reason for I'm asking.
Yeah, you know what? I think our very first introduction, yes, was my husband would share patients with Dr. Esselstyn. That's the first introduction, but really kind of simultaneously, our kids were on the same swim team. So we knew them from that. And their kids are, Jane is a phenomenal swimmer, as are her siblings. And then Jane's children are all unbelievable swimmers as well. And so, they're the stars. So everybody in the city knows their family for swimming as well.
Right. The reason I ask is I remember I used to produce conferences. I've done 19 of them. And I remember I was trying to get Dr. Esselstyn to speak at one, and he couldn't do it because it was Labor Day weekend, because apparently there's something going on the block. Do you know about that? Like,
so actually, they're on one end of the street, we're on the other. And so theirs is a little more of, they do their thing and we're across the street. But so no, we were not part of that. So no.
Okay. Well, oops. I hope you weren't. Maybe I didn't. I was just wondering if I was just picturing this like big neighborhood parade or something like that.
Right. Yes. No, but we see Dr. Esselstyn still riding his bike regularly. So he's out there. Again, he walks the talk too. So anyways, yeah, small world, right?
Right. Well, nice
I don't know. Yeah. So I'm trying to share my screen. Can you see this?
I can't yet. Let me make sure I enabled it. Yes, I did enable it. So you're going to make sure that what you're sharing is on your desktop. We should have probably practiced it, and then press the green button, or at least mine is green, that says screen. There you go.
Okay.
Now you just have to get up on your screen and maybe get the rest of it to go away by minimizing it or just putting it in a certain format.
Whoops. Anyways, I don't know why that won't go away.
If you close that first, only have open on your desktop what you'd like us to see, and then minimize that like that.
There, right?
Perfect.
Okay. So, I don't know about you, Chef AJ, but I don't have a lot of full body pictures. And this is not me at my largest. This was me when I was feeling pretty good. So this would have been maybe about 15 years ago. And even looking at it now, what I notice is that even my feet are really full, fatty. I mean, I've lost, since I lost the weight, I've lost about a half to a full shoe size. Anyways, this was one of the very few pictures that I have. So I thought I would show it just to show, but this picture is probably better. This one, there's my always naturally thin husband. You can see this one now or not yet?
Uh-huh.
You can see, okay, perfect. So I'm on the left in my view. Anyways, this would have been maybe June 2010. And September 2010 is when I began my most recent and, most sustainable weight loss journey. But you can see, I'm pretty big, and that's only just a half shot. And no, I'm not pregnant in 2010, but what I noticed most for me in looking at that picture is that my facial features are consumed by the fat in my face, by my cheeks, my fat. And so, seeing this picture was really what motivated me to change what I was doing. And here's a side by side. So you can see, again, I just took that picture, took my husband out of that picture. And then this is me a few years ago at Thanksgiving. And again, it's about the same distance, and just my mouth is bigger. My eyes are bigger.
God, that is quite a difference.
This is the after. So that's about 70 pounds difference. So anyways, I will get rid of these for now.
Fantastic.
Whoops.
Jane says they're a wee cult on Pepper Ridge Road.
Yes, walking distance for sure.
With her.
Anyway, is my screen back the way it should be already?
No. Are you done sharing for now?
Yes, for now.
Okay, then press stop share. It's on the top. It should be on your top.
Share. Okay,
stop
good.
Share. And then you'll come back big. There you go.
Okay, perfect. Thank you. This technology, Anyway, so, I guess I'll start with my story, then I'll start at the beginning, and then maybe we can, talk about more current things now. So, I was born in 1961. So Chef AJ, you and I are about the same age. And although I was born in New York, I grew up in the Midwest, similar to you. I think my story pretty much begins when I was 4. I had a preschool physical, and I was told I had a heart murmur. And so I was hospitalized for testing. And you probably remember back then, all testing was done in the hospital. Nothing was outpatient. And I was told I had a, quote, hole in my heart. I know what that means now is that I had either an atrial or ventricular septal defect, which thankfully closed on its own. But what that meant for me at the time is I was given the instructions not to engage in any physical activity whatsoever. No gym class. We called it gym class back then. No bike riding, nothing. I was sedentary. And, again, back then the food was different. And so I was a little bit overweight as a child, but we didn't have the highly processed foods to the extent that we do now. And so just by growing taller, I was able to maintain more or less a normal weight. But when puberty hit, and I know Chef AJ, you've talked about this yourself as well, I stopped growing taller and grew wider instead. And I'm not very tall. So when I was probably 12 or 13, I weighed about 150 pounds. And, sadly today, Chef AJ, that is
normal.
typical,
Or not normal, but typical, right?
Yeah. At that time, I was an anomaly. Nobody weighed that. And I didn't know what to do about it, really. There wasn't the information and just people weren't in that situation. So, in addition to negatively impacting my health at the time because of the diagnosis, what it really did is I tried to turn it into a positive thing, even as a young person. It inspired in me the desire and the passion to go into medicine. And so long story short, I went to medical school and I did 2 residencies. I did residencies in internal medicine and in pathology, both. I loved both. I love everything about medicine. I thought at one time I wanted to be a surgeon. I love it. I think it's fascinating. And so I was practicing as an internist when a neighbor of mine asked me to cover for pathology practice for a short while, at which I did and loved it so much. I've been practicing pathology for almost 30 years now. So, through this time, I've been, on my own wellness journey, as I mentioned. And so I've been reading a lot about nutrition, things that we didn't learn in medical school, and things, I'll go back to the Esselstyns and say, poor Jane and her oldest daughter, when they were on the swim team together, we would host functions at our home for the swim team. And, we didn't know about plant-based or no oil. And, we knew that they ate plant-based. And so we tried to accommodate, but we were cooking with oil and they were very gracious about, what we were serving their child, but they were probably appalled and we didn't know. And so, it took a long time for us to educate ourselves about all the toxins that are readily available to us in the grocery store and how to change our diet. So, the long story short is that, even though I was a practicing pathologist, I was still very interested in learning about nutrition to both improve my health, my family's health. But, it came to the point where I realized that not only could I improve my health, prevent disease, but through the lifestyle medicine presence, reverse disease as well. And so in 2020, I became board certified in lifestyle medicine as well. And at this point in time, I really feel the urge, the desire, the passion to give back to other people because my life has been changed so significantly by changing what I've eaten. And, even though I'm a very private person, I think it's so important that as many of us as possible spread the word about how we can change our health. And, my belief is that one meal at a time, one person at a time, together we can change the health of the world. And so that's what I'm trying to do. And I don't know what that's going to look like or how that's going to come to be. But I think starting with my own story, is a way to go. So, I know people probably out there are interested in, in weight. Well, I said, the punchline was how much I lost, but what was my journey? And I guess 1975, I went on my first diet. And until 2010, this beginning of my most recent path, I yo-yoed like a lot of chronic dieters. And I always say I yo-yoed myself into becoming obese. And I tried absolutely everything, programs that provided you food counting, weighing, measuring, no carb, low fat, whatever. And nothing was not only sustainable. I felt deprived. I was discouraged. I was demoralized. I know, Chef AJ, you've talked about this too. And people out there may say, well, it's obvious I was a food addict, but, I had been to Overeaters Anonymous, a 12-step program for 3 years, and I didn't identify. And so I really spent a lot of time trying to figure out, well, what is it? And, I knew in part I'm an emotional eater, that when I'm tired, I eat to soothe. And, going through residency and being in the practice of medicine, you're tired a lot. So I ate to soothe. But I wondered if there was something else eventually I decided it didn't matter what I labeled myself as, that the solution is the same. It's to abstain from my triggers, right? That the key, as you know, Chef AJ, to not having struggle is not having cravings. And if you don't put in your body the things that are going to trigger cravings, then you don't have cravings. And, I know you've talked a lot about the pleasure principle with Drs. Lyle and Goldhammer and, the stimulation of dopamine. And, I do believe that the false food industry has hijacked our brain. A lot of people are using that expression now into having us, the food itself is addictive. And, there's a big spectrum of how we respond. And I'm sensitive to these food substances. And so my life is better without them. And I think that that's, for me, your secret's ultimate weight loss. When you talk about starting your day with vegetables for breakfast, that is something that has been so central to my, changing my relationship with food and my weight loss. And I am not hungry. I'm never hungry. I'm satisfied. I have food freedom. I'm at peace. And, what more could you ask for? And I am not deprived. And, I tried intuitive eating for a long time. When I was using the standard American diet, it didn't work because I was hungry all the time. Now it works. So it's easy. It's easy now. Anyways, and I know, I'm preaching to the choir, Chef AJ, because my experience has paralleled yours a lot, which I think is why your book has really resonated with me and been so motivating for me. But anyway, so my story and my secret is your secret, is how to attain and maintain, a healthy weight without struggle, is to eat a whole food, low fat, plant-based diet, free from sugar, oil, flour, alcohol, salt. And that's my plan. And, it's pretty easy to follow. And I enjoy my food more than ever before. And my family has said that, we eat better now than we ever did before, that the food tastes better. So, anyway, so that's the beginning. I don't know if I'm talking too much. I don't know if you want to say anything. Or
no, I want to thank you. And I'm just so honored. And it's amazing to me. I just have a couple of questions in your journey, because I'd like to know a little bit more about the different diet styles you tried. Yes. But had you heard about a plant-based or a vegan diet in any of your part of this journey?
I was vegetarian in college just because I didn't like meat. I know Jane mentioned that yesterday about herself, that she didn't like meat. I didn't like meat. And so I was vegetarian, not for ethical reasons, not for health reasons. I just didn't prefer. The problem is, as I progressed, before I, started to become aware of wellness, I really had a lot of boxes. I ate a lot of box crackers and cookies. And so even though I wasn't really eating so many animal products, even at that point, I was clear on board with the standard American diet. My lunch would be regularly, I don't know if you remember those Captain's wafers, the 6-pack of the Captain's wafers. It had like some kind of cream cheese filling, whatever, and a banana. That would be a very typical lunch for me. And no, it's not healthy at all. But, I've heard over and over the expression, we do what we know. And when we know better, we do better. And so thankfully, again, because of people like you, the Esselstyns, a lot of other plant-based people, my awareness was increased. And it got to a critical mass. I couldn't ignore it anymore. And I had to really look at what I was eating. But no, in medical school, no. I know you've heard this over and over. Medical school, no. It's terrible at educating about nutrition. And the tragedy there is nutrition is the crux of wellness. And how can we not look at that? Anyways, hopefully things will change. I know, again, going back to the Esselstyns, they're really involved in helping medical school change curriculums and educating medical students. And I have hope that this will be different in the future, but for me, it wasn't.
What is your practice like now? Is it in person, virtual? Tell us a little bit about what you do.
So I'm a practicing pathologist now. And, I have a website where people can, contact me and have nutrition consultation, but I have not been practicing I haven't been in patient care for a number of years now. And again, trying to figure out how to get back into it. And, what I want to do is kind of like what you do, kind of like a lot of other people in this field, really work to help people use food as medicine, not use medicine to mask disease, to put a Band-Aid on it, but to really reverse. And that still is a little bit of a niche area in medical practice. And so I'm not sure what it's going to look like eventually, but it's my hope that somehow I'll be able to, use my own personal experience and my knowledge and help people in this way. Whatever, I don't know, having people hear my story today may motivate somebody to say that they can do something like this too. So, we'll see.
Well, as a pathologist, you're not actually seeing patients. So
right.
You can't really talk to their tissues and say,
no.
hey.
No, but and if we have time, I put together just a little brief PowerPoint just because pathology is so visual, but there's so many times on my side of the microscope, pathologists are called like the doctor's doctor because we interact more with the clinician and not the patient directly. But there's so many times I want to go to the patient's bedside and say, you don't have to have this diagnosis if you just do X, Y, and Z, because I know that their doctor is not telling them these. And so, it is frustrating is not the word, because I know people don't know. People just don't know. And so, I try to talk to their doctors about, well, people may not have inflammatory bowel disease if they ate more fiber in their diet. And it's still a little bit kind of out there, not considered mainstream. And so it's hard to sell. So that's why I thought maybe selling it by weight loss, that was my portal right into this wellness journey. I wanted to lose weight. And by getting in by wanting to lose weight, I've been able to change so many other things in my life. And, maybe that's the way. I don't know. But yes, no, so I don't see patients now.
Yeah, but the fact that you got your another board certification in lifestyle medicine will be perfect when you do start seeing patients.
Right. Yes. So hopefully, again, I'm at the beginning of this, and so, I guess I wanted to go back just and talk about, I don't want to. Jane and her mother, Anne, talked yesterday. I don't want to talk about them too much, but because they were so instrumental, I want to just kind of circle back and talk about, what happened. So I said in 2010, I started my most recent weight loss journey, and really, what facilitated that, I think, was regular exercise for me. And I realized that by exercising regularly, by walking, I was able to substitute the endorphin, the dopamine response that I was looking for food to provide, and was able to then follow a low calorie diet. So in 2010 to 2015, I was not plant-based, but, I started weighing myself to be accountable. I started really trying to pay attention to nutrition. So for 5 years, I just tried to kind of improve my diet, and lost a little bit of weight. Now in 2015, as I said, my daughter came home from her first year of college and was working with Esselstyn's. At that time I was reading a book. I don't know if you were like this, Chef AJ, but I read a lot of self-help books and diet books to try to figure out, how to fix this. It was called The 22-Day Revolution by Marco Borges. And the premise
was on the show. He's wonderful.
Mm-hmm. Yep. That it takes 21 days to make a habit. And so if you stick with something for 22 days, your habit has been solidified. Well, we know that it takes a little bit longer, but at the time, that was in my mind. Also, I'll never forget the day. It's my anniversary, May 5th. I was in the grocery store, and the person behind the counter slapped, a fish on the scale, and it sounded like a dead body to me. And you remember, I'm a pathologist, so that dead body was something it never really occurred to me. That fish is a dead body. And I was so repulsed by that. The sound of it, the awareness of it, that when you're eating animal products, you're eating dead flesh. So the confluence of all those three things, facilitated for us the decision to, jump right in. We said we have these recipes at our disposal to test. Marco Borges says it only takes 21 days to make a habit. And I wasn't really that keen on animal products to begin with. So let's see what happens. We made a commitment as a family, 22 days. And part of our immersion process, we watched the Forks Over Knives and the Food Inc. documentaries. And, although initially the struggle was real, it was hard not knowing how to cook, what to eat. But thanks to the Esselstyns and their recipes, we did it. And at the end of that time, we realized we couldn't go back to eating the way we'd eaten before. We couldn't, both for personal health reasons and for animal welfare reasons and for environmental reasons. And so we've been plant-based, vegan since May 2015, plant-based. And, we've continued to tweak our diet, but, I have to say, I lost weight effortlessly, without cravings, without deprivation. The more significant bonus, the benefit, is that I have not been sick one single day since May 2015. Zero, like nothing. And that is worth more than anything that I can tell you. So, the benefits are far reaching. And I was somebody that, except for by every measurable parameter, was healthy except for weight. I'm still telling you that my health improved multifold.
It's incredible. There are actually people on that don't know what a pathologist is or does. So maybe give a brief synopsis of your job.
Okay. I always say pathologist examines microscopically anything that might be taken out of your body, whether it be cells like a pap smear or a breast biopsy or a total colon, if you've had a colon taken out, anything that might, pieces, parts, anything that might be taken out of your body. I examine microscopically and then render a diagnosis. In addition, pathologists, something that a lot of people don't know, we oversee the clinical lab. So we look and assess, what our normal range is, particularly if there are new tests, and make sure that, we're in compliance with, quality control. And if you're getting blood, make sure that that is matched appropriately. So anything having to do with that kind of blood work or parts of your body that need to be examined.
You don't really need to have a good bedside manner then, do you?
No, not at all. No.
You really don't see patients, really. You never really get to talk to your patients.
Not too much. There are some procedures. So bone marrow biopsies, a lot of times pathologists will do those. There are fine needle aspirations, which are, taking small samples of cells in mass, like a lymph node or a breast biopsy that we do. But by and large, no, we're behind a microscope, and in the lab with the lab staff.
Well, it'd be so interesting if you can combine I almost feel like there's a book in this where you can combine what you see with, with if only they had changed their diet, or if they will change their diet, see how it can improve.
Yes. Well, I know, Chef AJ, I've heard you say yourself that your colon was riddled with polyps and that you changed your diet and they were gone.
Nobody believed me, because at the time I wasn't thinking of doing this, and I didn't even save the pictures. But I'm telling the truth, like they're gone.
Absolutely. Absolutely. And that's what, when I see patients with polyps, I want to say, and the interesting things I will hear people say, whether it be family members or friends, oh, no big deal, I had a polyp, was taken out. Well, it's a big deal because the milieu that created that polyp, if you don't change what you eat, is still going to be present, and you're going to get more. And maybe next time you won't be so lucky. And so, yeah, there's a big message to be given, that anything, my belief, pretty much anything, if it can't be completely reversed, it's going to be helped by what you eat and by lifestyle modifications.
Right. Here's a question from a live viewer named Emily. Has Dr. Rimmerman read Dr. Vera Tarman's book, Food Junkies? And what are Dr. Rimmerman's thought on food addiction?
So I haven't read her book, but I've seen her interviewed. And, going back, I guess, to my own struggles, I like trying everything and realizing that I was, an emotional eater because I ate to soothe, because when I was tired, I wondered if there was something else. I said I'd been to a 12-step program for years, and there are, criteria for food addiction, for eating disorders, and there's a DSM, and she talks about this also, there is some overlap, but I have to say, I've never fit in any one category. Yes, I've had a little bit of this, a little bit of that. Look, I never fit. I never really identified. And that's why I said after a while, I decided that for me, the label wasn't so important. It was more important to take action and just know that for me, I needed to abstain no matter what. Because the label, number one, the people, feel judged by labels. And it's not even so much that for me, because I'm willing to say, if I've met the criteria of food addict, I would say I'm a food addict, because it seems like it'd almost be easier to say that and then do it. But I'm not quite a food addict. I'm not quite, don't have eating disorder. But, for me, I kind of put it, going back to the pathology, I say if I at least eat sometimes for reasons other than hunger, or at least sometimes eat beyond fullness, then my relationship with food is pathologic. And that's enough for me to say, I need to do something about it then. And doing something about it for me, again, is the abstinence part. And again, I think it's something I was looking to have a box, to have a label. I thought that would help me. And I've come to realize that it really is an individual thing. And I know there are a lot of plant-based people who eat maple syrup without a problem. Maple syrup for me is a big trigger, and I need to stay away. Dates don't do anything for me. And so I guess that's kind of the long way of saying, am I a food addict? Not according to the criteria, but if it walks like a duck, quacks like a duck,
right?
It's a duck. So technically, no. In practice, I identify with a lot of different things. So I just need to do what I need to do, right? And not worry about what it's called. Just take action. That's more important, I think.
Right. The name is not as important. People are always saying, but, they don't understand like how addictive these foods are for so many people. They go, well, if I only had more willpower. You don't need more willpower. You need less temptation. And yes. That's really the secret.
Absolutely. Absolutely. And I know, Chef AJ, you talk about cleaning up your environment too, which is so important. People have studied this about, decision fatigue. And as the day goes on, it gets harder and harder to make good decisions. And don't even put that into the equation. Just take it out of your environment. And then you don't have to make good decisions, because if it's not there, you can't eat it. Anyway, so that's my experience. And so, who knows, a year from now, I might say something different. 10 years from now, I don't know, because I think this is all a process in terms of, knowing ourselves and knowing how to feed ourselves and knowing what's best for ourselves. And that's where I am now.
How quickly did you change your diet when you learned this information? Was it literally overnight, or did you transition more slowly?
From 2010, when I started with the exercise, and that I was able to stick to something for longer than just a few days, till 2015, when May 2015, we became plant-based. That's it. That was a total and absolute jump in, no looking back. So from May 2015 forward, again, we have been, plant-based since then. So that was cold turkey. And, for us, that worked. I know other people do it more gradually, but for us, it worked. And that's when I saw my effortless weight loss, was with the plant-based eating. It was not before. Before, it was still white knuckling it, and deprivation and calorie restriction. I knew it was not sustainable for life, but I didn't know what else to do. And then this plant-based way of eating fell into our laps, and it's been, I feel so amazing. That's the thing I want to emphasize again, more than the weight loss, more than not being sick. And I say to my husband, if I knew back then how well someone could feel, I would have done this a long time ago, but I didn't know.
Wow, that's amazing. So what kind of things do you eat now? People always love to hear success stories, what you eat in a day.
Okay. So I'll give you a typical what I eat for a day. And I'll start by saying, Chef AJ, the vegetables for breakfast, there was something when I read about that in your book that I knew that was something I needed to do. Well, I started my vegetables for breakfast by eating carrots. And, I thought, okay, but I'm going to kind of interject here now and talk about something else for a bit. Again, I said this is all a process. So earlier this year, I was granted the opportunity to wear a continuous glucose monitor, and I don't have diabetes, but I wanted to see for myself how my lifestyle choices affected my blood glucose level, because I really think that's the kind of the window into our metabolic health, is looking at what our blood glucose is doing, not only your baseline blood glucose, but how your blood glucose responds to meals and what your variability is. Anyways, one of the first things I noticed that even though my blood glucose fasting was normal, throughout the day was normal, when I ate my carrots for breakfast, my blood glucose would spike. These are vegetables. I know they're root vegetables, but they're supposedly low glycemic index vegetables. And so, something that I thought was a good habit that I was adopting really was not good for my blood glucose. And everybody, again, is an individual. So, I took this as an opportunity to do something different. And I read your book more closely, and you say green vegetables for breakfast. You don't say vegetables. It's very specific. And so I changed, and that little change to broccoli, which my dog absolutely loves. My blood glucose, for my first meal of the day is vegetables. It's just this little baby blip. It changed my blood glucose response in an astounding way. And so that's what I eat for breakfast now. I want to go back to talk about the continuous glucose monitor, because I think that there are things that I definitely learned that I can share with other people, but I start my day with vegetables for breakfast. And then usually about 2 hours later, I'll be hungry again. And that's when I love oat groats. And I usually have oat groats with fruit, or I like making a lot of, an ice cream. I make blended up bananas with, I don't use nut milk. And, I have a couple of questions for you, Chef AJ, about that too. I don't use nut milk. I use, ice water and powdered vanilla. And that's what I eat. That's kind of like my part one. And then my middle of my day, I have I call it like junk salad, throw everything, any leftovers in, it's a base of kale and or spinach, and then whatever's in the refrigerator. And I always put California balsamic.
Well, you get 2 more free bottles today.
That's thanks to you. They are amazing. And they are amazing. And then anyways, and then in the evening, Chef AJ, I use a lot of your recipes. I use a lot of the Esselstyn's recipes. There are a lot of people on Instagram who I've connected with who are phenomenal cooks, and I modify some of their recipes or use them flat out, because I am me personally, I'm oil free. I'm nut free. Not all the recipes are, so I modify. Anyway, so that's pretty much my day. And I'm full all day long. I'm never hungry. So, some things I wanted to ask for you, and I wrote these down because I wanted to take this opportunity to see. So Chef AJ, what do you do about nut milk now? Because I know you say you don't.
Okay. So this is so interesting, because I don't feel that it's a beverage. So I don't want anybody drinking it. Obviously if they're drinking milk, it's a better choice, but for people trying to lose weight, it's still fairly calorically dense. But the interesting thing about nut milks is they range widely in calorie density. So for example, as healthy as soy milk is very high in fat and calories compared to, at least we're talking boxed. When you make it yourself, it's different, to like a cashew milk that you can buy that's 20 calories a cup versus 140 calories a cup. So if you make your own milks, you can control the amount of water. You can make them as thin or as thick as you want, thereby changing the caloric density. Since I really don't use nut milk, with the exception of in a couple of cream soups like cauliflower bisque, it doesn't much matter because the overall caloric density is being diluted by, the 8 to 12 cups of water in the soup. But again, Dr. McDougall's words, the fat you eat is the fat you wear. I know it's true for my body, because every time I start dabbling in just a little avocado, a little seeds, nuts, I will not touch at all. They're too addictive. My weight goes up 5 pounds. And I mean, like immediately, like, within, just a couple of weeks. So for me, I just kind of avoid the nut milks. And, I really just, they're not part of my diet. I mean, I might put a splash in a cup of tea, but we're talking like, the tiniest bit, but I really don't use them.
No, I agree with you. And again, this is an individual thing, right? My husband is very thin. He needs nuts. He will lose weight like that, like drop of a hat if he does not have nuts in his diet. But for me, I'm like you, just a little bit. And going back, then circling back to the continuous glucose monitor, what I noticed again, not only did the carrots for breakfast spike my blood sugar, but my blood glucose variability was not ideal in my opinion. And, your blood glucose probably should not increase more than 30 milligrams per deciliter after a meal in the ideal situation. And my baseline was fine and my overall was fine, but my blood glucose variability may be 40 or 50. And, there's some things you can do. You can, because to me, if you have a little bit more blood glucose variability than is optimal, it means you have some insulin resistance. And again, by all measurable parameters, my triglycerides were perfect, my HDL, my blood pressure, everything. And there's a kind of a quick and dirty way you can look to see if you're insulin resistant, looking at your triglyceride to HDL ratio, and that should be as close to 1 as possible. Mine was less than 1. Yet the fact that my blood glucose was rising more, I had some glucose variability or some insulin resistance. So you can do intermittent fasting, which I'd done for years, kind of accidentally, just because I didn't like to exercise like you in the morning with food in my stomach. So I was intermittent fasting accidentally. But anyways, I eliminated all nuts, nut butters from my diet, which I was not eating outright. I was cooking with them. I was using them in whatever recipes. Within 3-4 days, my glucose variability went back to a very narrow range. So rather than having, peaks and valleys, I just had little blips, which is ideal. And I lost a few pounds in a few days, which I didn't even know. Not that I wasn't trying, but I didn't know I had to lose. Anyways, and so for me, what I learned from that, and Robbie Barrow and Dr. Cyrus Kambata talk about this all the time about, managing diabetes with decreasing your fat. And so I learned for me really that insulin resistance is the result of too much fat in your cells. And that if you're able to decrease your fat in your diet, decrease your fat in your cells, your insulin resistance improves. And so, I think that was the biggest overarching thing I learned from the continuous glucose monitor is really firsthand that insulin resistance is both the cause of and the result of excess body fat. And that it is a cycle, and the way to break that cycle is really to eat a low fat, whole food, plant-based diet, eliminating sugar, oil, flour, alcohol, salt. So that's what I follow now. Anyways, I think I mirror what you're doing as well.
Nice.
But I did have another question for you then, Chef AJ, and I wrote this down too. What about, I said for you, or I said before, dates for me are not a problem in terms of triggering.
Yeah, me neither. I think they're almost too sweet. So I don't eat them, but I'll put them in recipes.
I put them in recipes. I don't eat them either, but
it's the sugar and fat combination, at least for me. I mean, not that I want to eat Twizzlers or gummy bears, but I probably could eat them all day long. And it's when you have the sugar with fat, because Dr. Lyle always talks about how in nature, we weren't meant to activate the sugar, fat, and salt pathways all at the same time. Mm-hmm. And how with very, very rare exceptions, there's no food in nature that has sugar and fat, sugar and salt, fat and salt, or sugar, fat, and salt. So just sugar by itself holds no appeal, but you put it with fat, which is basically most desserts or chocolate or ice cream. And then I get really excited.
I like your visual. It's fun.
This is such a random question, and I don't know why we're getting it lately, but do you wear bindies?
I heard that question in Esselstyn's yesterday. And I didn't even know what they were, honestly, till they said. So no, yes, but yes, no.
Isn't that funny? It's just, we've been getting it a lot lately.
I don't know.
Bethany wants to know, when you do start practicing, however your practice will take shape as a lifestyle medicine doctor, what community will you be practicing in? Will it be like more of an in-person, virtual, both?
I guess I envision it more virtual, because that's kind of, since the pandemic, that's the way our world has become, right? And a lot of people have really grown to like the virtual practice. And, what you do in lifestyle medicine, you still don't need to really examine somebody if you're looking at their blood work, if you're talking to them about making changes in their diet. And I guess if I had to talk about, the ideal world is, I think that, blood testing for a lot of other different things is hopefully the wave of the future. I know, we're talking a lot more about metabolic health, And the things that we're talking about and learning about, people aren't even measuring now. So, do you know your fasting insulin? I've never had it done, but it is useful because your fasting insulin is going to tell you whether or not you're insulin resistant in part. Do you know your uric acid level? That also helps to tell you that. We talk about supplementation with vitamin B, calcium, vitamin D. You might have had a vitamin D level tested, but have you had a vitamin B level tested? And, I think there's room for a lot of evaluation in terms of, making things personal. Not everybody needs to take calcium supplementation. And me personally, I'd prefer to get it in my diet, but I won't know whether I need to take supplementation unless I have a measurement of that. So that's a long-winded answer of saying, hopefully it would be more, virtual online, but also maybe a little bit different, maybe focusing a little bit more on, can we measure the effects of what we're doing, what we're eating, and have people get feedback that way. So.
Well, here's a question from Linda, a live viewer. It's about the gallbladder. Maybe you can answer it because I'm sure maybe maybe that's an organ when it's taken out. You get to look
absolutely.
At it.
I've seen many times. Yes.
What's your favorite organ? No, just Linda says, my carnivore 22-year-old granddaughter had her gallbladder removed last month. No one told her to change her diet. Her gallstones were infected. Will she experience future health issues regarding her having no gallbladder?
Some people do, because the gallbladder helps to digest fat. The bile that's secreted by the gallbladder helps the fat break down. So some people do notice more difficulty digesting fat, but if your diet's low in fat, then you shouldn't have a problem. So I guess it could be another motivator for eliminating fat in the diet, because if you do have side effects, you might be more inclined to avoid the fat. So it might be a good thing.
Yeah. Well, I'm guessing she's not vegan. She's probably, I guess ostensibly one could eat a carnivorous diet lower in fat, but
Yeah, no. And 22, that's young. And so, again, I always try to focus on the positive and say it's an opportunity, because all of these, anything we're told, any label we're given as a diagnosis is an opportunity to change what we're doing so that we don't have to live with whatever that diagnosis is or was, and we can move forward in better health. So,
hey, one thing we haven't talked about yet, and I don't know if this played a role in your journey, is exercise or movement. Is that something that you do a lot of?
Right. Like I said, initially when I was hospitalized, I was told I couldn't ever exercise. And, as I got older and I realized, okay, I'm not really a cardiac cripple as I was told I was, I started to, because I realized that, I felt good with exercising. And so, I'm not a crazy exerciser. I really like to walk. I love to do the Peloton bike. I like to do yoga. I like to do, some strength training just at home. But I feel really good. And I like the feeling of being strong and feeling like I have good balance and flexibility. And, it's kind of a new world for me, having not had that when I was growing up. So I love it.
You can go riding with Dr. Esselstyn sometime.
He is way beyond my abilities, way.
That is so cool. So cool. Let's see. Emily says, I've heard of people wearing those continuous blood glucose monitors. I'm kind of curious, but I don't know how to do it. I could have swore I saw them for sale at Costco. I don't know.
Wow, that's amazing, because right now my understanding was to get a finger stick, you can get that anywhere, but to wear the continuous glucose monitor is still by prescription only. And so, like I said, I solicited Abbott, who is the developer, provider, and producer of Freestyle Libre, and asked them if I could wear this. And so, they have people on staff there that evaluate on a case-by-case basis the request, and they have their doctors approve and then go through the pharmacy. So that's how I got mine. Anyways, but there are other companies that do this as well. Right now, I think it'd be great for this to be widely available to the public, for people even as a spot check to see what they're doing. And I want to, Chef AJ just mentioned something briefly. I said I was going to circle back, but one of the other things that was really significant, well, two of them in my continuous glucose monitor wearing, is that regardless of my meal, if I started the meal with green vegetables first, my blood glucose rise was muted. And so I learned that meal sequencing is important too. And I know we hear a lot about it, but for me, definitely and absolutely. If I had my vegetables at the end of the meal, it was not quite as, did not have quite the impact as it did if I ate them first.
If I ever like update my book, which I did my last book, I'd love to have that as a testimonial, because I've been telling people this, been for like 10
Absolutely.
years. Dr. Goldhammer talks about this first, sequencing. He has his patients eat a large raw salad, a large serving of steamed greens, and then their starch. And not everybody, but people that are either wanting to lose weight or struggle with food addiction. It's really the
Absolutely.
secret.
Absolutely. The other thing that I identified, which, it's not practical for every meal, but a short 15-minute walk. I do it in my house, do circles in my dining room after a meal. Again, that glucose response is muted. And that's something easy to do. Again, I live in Cleveland. It's cold, it's snowy, it's icy. You're not going to go out in the middle of the day or, it's 7:00 at night when it's dark to walk, but you can do it in your house and it doesn't have to be strenuous. And that really helps. The last thing I'm going to say that I learned, I know you've had this woman as a guest, Dr. Hanna Kaliova, and she talked about the 2 meals a day with intermittent fasting, skipping the evening meal. She talked about, eating breakfast like a king, lunch like a prince, and then eliminating, right? If you're going to
dinner like a pauper or not, well, a pauper might not have any dinner. Yeah.
My blood glucose loved that because mine naturally goes up as does most people throughout the day. And when I skipped an evening meal, my blood glucose was beautiful that day and the next. That was hard to do though. Yeah. So I tried to do kind of a hack. I tried to do your vegetables for breakfast at the dinner time instead, switch that. And my blood sugar still like that. Now it's not something I do as practice because socially, it's just kind of it
is harder if you're,
it's harder. It's harder.
It's, I don't know if you've ever heard of Dr. Neil Nedley's been on the show at the Weimar Institute.
No,
it's pretty phenomenal, but he's actually, that's one of the reasons I moved here was just to get a vegan doctor. Cool. But they have a live-in program called New Start, kind of, I think it's similar to when Dr. McDougall had a live-in or True North, and their last meal is 2 p.m. Yeah, that's it. Like that's their second meal. They don't get any, and that's it. Apparently it does help.
It does. It does. For me, I found it harder to sleep deeply. I thought I was hungry. And then I was so preoccupied with what I was going to eat. I was so hungry, but it's still in the back of my mind, that it's something worth considering because it really does. It does help. And again, looking at metabolic health, I think, it's something we need to be aware of. Definitely.
Yeah.
So
Emily wants to know if you can be friends with her on the Peloton.
Yeah. If I can remember my name, it's not very, I think I'm MSR 57. I think that's it. If anybody wants to know, MSR 57.
I didn't get the Peloton just because I just, I do my own thing. And it's like, I don't even notice that I exercise anymore because that's the only time I allow myself to watch something, on Netflix.
Right.
And so a lot of times I'm spinning longer than I need to because the show, it depends how good the show is. That's why I got to pick a good show.
Right.
And
right.
It's just funny. It's like, the hour just flies by because
that's great.
Yeah. It's my little secret. So here's a question from Laura. How can you test to see if you are insulin resistant? Also, what instrument can you buy to see if your sugar spikes? I'm not at all diabetic, but what you're talking about would certainly be a good test to help with this way of eating.
Mm-hmm. Right. I think there are a lot of different ways. I think if you were to wear a continuous glucose monitor, which again is by prescription, but you can bypass your own personal doctor and go query the companies directly if you're willing to pay for it. If you see blood glucose variability, so peaks and valleys, that's an indication of insulin resistance. The other is, again, looking at the fasting blood glucose in relation to the fasting insulin. So if your insulin is high, your fasting insulin is high, even if your fasting blood glucose is normal, that indicates that you've got some insulin resistance because that means your body needs to put out more insulin in order to get that lower level. So that's another measure. An indirect measure, as I mentioned earlier, if you look at your triglyceride level and it's a ratio to your HDL cholesterol, the closer it is to 1, the less likely you are insulin resistant. And then really, I think, you know, body fat analysis, if you have an impedance scale, and if you look at your body fat, if you have any extra body fat, that tells you you're insulin resistant by definition, because if you weren't, you wouldn't have that body fat. You wouldn't have that extra body fat. And so, you know, again, there are varying degrees of insulin resistance, but I think these are some of the kind of quick and dirty ways you can assess whether you have insulin resistance. And then, you know, there's lots of other things people will say. Do you get hangry? Can you manage going between meals without feeling like you have to snack? How well is your blood sugar managed on a hunger level throughout the day? How immediate is your hunger when it strikes? Those things mean or suggest that you do have some insulin resistance. So I think there's lots of different things. And I think keep your eyes open, because there's more and more information about, metabolic dysfunction and being silently insulin resistant, and how, people have diabetes and prediabetes that don't even know about it. And then there's even short of that, people that are insulin resistant that aren't even manifesting those yet, and could be could optimize their health more. Anyways.
Great. I don't know if you can answer this question. It's about cancer, but I'll read it from Janet. When breast cancer comes back in the bones, is it considered breast cancer or bone cancer? Are the cancer cells different when it comes back after a few years of being in remission?
Okay. So when cancer goes to the bones, it's considered metastatic breast cancer. Microscopically, they will look like breast cancer cells, even if that cancer is truly a metastatic cancer, even if there's been years of remission. And that's a whole nother discussion, but, it does indicate really that there were cancer cells that were below the threshold of being detected present in the body that took up residence in the bone later on. It's not that, it's not, if a cancer is really truly completely eradicated, it doesn't come back. If you get some after remission, if it comes back, it means it really was there. And so again, so important to do whatever we can to modify our milieu so that we're not cancer promoting, so that we don't have, insulin is growth promoting, right? For people and for tumors. And so if we can lower our insulin like growth factor, which is present in a lot of animal products, then we can decrease our risk for cancer in the first place, decrease our risk for recurrence. So.
Great, thanks. Oh, I think you're going to love this question. Please talk to us as a pathologist. What do you see that can be changed with the plant-based diet, and the ideas for your future book?
Oh boy. I would say just about everything. And like I said, in the interest of time, I won't do this, but I had a little bit of a PowerPoint.
Well, no, you can. People would like to see it. I mean,
but it's going to take forever though, right?
I don't know how long it is.
Okay. Let's just do that then, because this is just, a couple different. Now you're going to have to guide me through this again.
So first put it, before you push the screen share, have it up on your screen first. Have what you want us to see up first. So do that first.
Yes.
Have that be your main desktop. Now push the green button that says screen share.
Whoops.
It should work.
Whoop. No. Hang on.
You did it before. You can do it again.
I know. Oh, I see. Hang on here. Share screen.
There you go.
Okay.
If you put it in the mode called slideshow, we won't see all your desktop and things like that. So there you go. Perfect.
Okay. So just briefly, I thought I would talk about reflux, Barrett's, and then colon polyps, just because these are things that just about everybody either has or has heard of, or people know. And you've had gastroenterologist, Dr. Bulshewitz on here, and other gastroenterologists. And so, people are becoming more aware of these. GERD, gastroesophageal reflux disease, is now the number one diagnosis for anything. Everybody has it, apparently, and it's becoming more and more common in younger people. And reflux itself is uncomfortable, and again, is a marker more of disease. It is a disease itself, but it's more of a marker of what can come. And what can come is Barrett's, and Barrett's is a premalignant condition of the esophagus that is completely and totally related to lifestyle factors. So from my end of the microscope, I'm going to just talk about this a little bit about Barrett's and then about polyps. So first here, this is just a little schematic of the esophagus, stomach, and proximal duodenum, proximal small bowel. And the esophagus really is just a conduit for the food to be propulsed from the mouth into the stomach. It's a tube, and it's separated from the stomach by something called the lower esophageal sphincter, which is really only a kind of a virtual separation. It's a band of muscles that ideally is closed so that the acid and the food contents of the stomach are separated from the esophagus where they don't belong. However, with reflux, either because of mechanical issues like a large abdomen protruding from, pressing from the outside, or other lifestyle factors such as, cigarettes, alcohol, fatty foods, large meals, eating just before you go to bed, the contents, as you see, if I had a pointer, I'd be able to point, but all those green bubbles are supposed to be the stomach contents and acids. They reflux. They actually go back into the esophagus where they don't belong and where the mucosa or the lining of the esophagus is not equipped to handle the material, the pH of that material, which is why then people with this disorder will get proton pump inhibitors to try to keep that sphincter closed, to try to keep that area separate. So the body, in a compensatory mechanism, replaces some of that epithelium in the esophagus with epithelium that looks more like colon mucosa, which contains mucin, mucin-producing cells, which can release mucin into the esophagus and help coat the esophagus. So the body is really phenomenal at being able to protect itself. However, this compensatory mechanism over a prolonged period of time is premalignant. And that's the part that we need to focus on. Reflux is uncomfortable. People take their medication. People think it's not a big deal. It's a big deal to me because, if I were talking to you directly as a patient, I would say, you've got reflux microscopically. This is your opportunity to change your diet, change your lifestyle, and make sure you never, ever, ever get esophageal cancer. Instead, a lot of people have reflux. A lot of people take medications. And as you've heard before, Chef AJ, medications do not take care of the problem. They take care of the symptoms, but the problem is still ongoing. It doesn't really take care of, get to the root cause, and then you don't have the problem anymore. So the risk factors, again, for Barrett's are the same as for reflux: diet, obesity, alcohol, coffee. People with diabetes and with motility disorders are also at risk because you want to keep those contents moving forward. You don't want them to back up. And again, this is an indication that you can possibly prevent the development of esophageal cancer. So again, pathology is visual. So I thought I would show a few images here. On the left side of the screen is an upper endoscopy, and you, as the person sitting in front of your screen, would be at the mouth region, and behind your screen is the stomach. And this is at the gastroesophageal junction. And you see there should be a nice, clean demarcation between the smooth pink esophageal mucosa and the more reddish stomach mucosa. And you can see here, like maybe the 6 to 7 o'clock position, and then maybe the 1 to 3 o'clock position, there are some jagged edges, and we call this salmon colored tongues. This is considered Barrett's mucosa. It occurs more than 1 centimeter above the esophageal junction and is confirmed microscopically to contain these specialized intestinal epithelial cells, which on the right-hand side of the screen, the top of the screen, you see that's normal stratified squamous epithelium of the normal esophagus. And below that, you see these taller cells that have these big globules in them. Those look, if you didn't tell me this was the stomach, I would think it was the colon. So microscopically, it looks like colon in your esophagus. Why is Barrett's important? Well, if you have Barrett's, you're pretty much committed to having endoscopic screening every 3 to 5 years. That's Barrett's without dysplasia. And what happens is, again, with enough stimulation, you will progress to having low-grade dysplasia, high-grade dysplasia, and then cancer. over enough time. And again, this is not a scare tactic. This doesn't happen right away. You have a lot of opportunities to intervene. But the far left side of the screen, you see that this mucosa, again, in this upper endoscopy becomes nodular. And these are areas of high-grade dysplasia. And high-grade dysplasia, in general, patients will have then screening endoscopies maybe every 3-5 months, and usually have something called an endomucosal resection, which strips away this mucosa to try to take away that nidus of dysplastic epithelium. And in the middle, that's that single kind of blackish, purplish nodule is an esophageal cancer. And what happens, you see, is that it actually starts to obliterate the lumen, and patients will have a lot of problems with pain and swallowing, difficulty swallowing. And then the far right hand of the screen, I just thought it was interesting to show what an actual adenocarcinoma of the esophagus looks like. And you can see it's formed from those columnar cells. It's not from the stratified squamous epithelial cells. And, you see that it looks similar to the cells I showed before, but, these nuclei are big, they're crowded, there's necrosis. So that's an esophageal cancer. And again, so important to know that patients don't have to passively accept a diagnosis of reflux or Barrett's, and that there's a whole lot you can do. If we have time, just I can kind of, because this is something I also think again is so important for people to know. The adenoma carcinoma sequence is very well delineated in the colon, going from polyps to colon cancer. And, it's not something that just happens randomly. We know what the precursor lesions are of colon cancer. And we know that if you change your diet, change your lifestyle, you can intervene. And again, this is for 90% of sporadic colon cancers. There are some familial cases that are a little bit different, but we'll talk here first about these sporadic cases. And I know, Chef AJ, you mentioned that you had adenomas, and adenomas can be characterized as tubular adenomas or tubular-villous adenomas or villous adenomas, and this depends upon their degree of architectural complexity and how they look under the microscope. And, the important thing to know is if you have a polyp that has the word adenoma in it, it is by definition dysplastic, which means premalignant. There are other polyps that are not necessarily, but if you're told you have an adenoma, even if it's one, it is a big deal, because that can become cancer. Yes, that individual polyp itself, once it's taken out, can no longer become cancer, but the environment that created that polyp will create other polyps. So the risk of malignancy does increase with increasing polyp size. And again, the lifestyle factors are so important. And with the adenoma carcinoma sequence, I want to emphasize diet, the low fiber, high fat, and high in meat, and I just kind of want to get on my soapbox here. And I know people have mentioned this before, that in 2015, the World Health Organization declared processed meats as a definite carcinogen and red meats as a probable carcinogen. Now, definite carcinogen is the same category as cigarettes. If you want to buy cigarettes, there are labels. You can't advertise in the magazines. They're behind the counter in the drugstore. If you want to buy processed meat, it's freely available to anybody. There are no labels. There's no limitation on marketing. It's for anybody. I don't know how those lobbyists got away with being able to continue to market to us when these are carcinogens. These will definitely cause cancer. Anyways, that's my soapbox for that. But anyways, in terms of other things that cause polyps, obesity, alcohol, smoking, again, lifestyle. And again, it's an opportunity. And I want to emphasize that over and over again. These are opportunities. Whatever health challenge we're experiencing is an opportunity to do something different. So just kind of a little diagram. The far left, the intestinal polyp, that's, people will say, I had an adenoma, no big deal. That's taken out. It's true. Once it's gone, it's gone. But, and these are slow growing in general, which is why in this country we have colonoscopy recommended to be done every 10 years. In other countries, there are other different ways of screening for colon cancer. In this country, we use colonoscopy, and they're slow growing. So again, we've got a lot of opportunity to make a change. Anyways, as the polyps get bigger, there's more likely to have cancer in the polyp, which sometimes you can still just take it out and it'd be gone. But then if enough time of enough, environmental stimuli occur, then these become cancer. And, these are bad. Colon cancer is bad. That's in a very vascular area. They become metastatic very quickly. The life expectancy, even with, current treatment is not very good, or not ideal anyways. The left hand side of this is a single solitary polyp. You see most of the mucosa is nice and pink, but at about the 5 o'clock position, you see this little nodule, which would be a tubular adenoma microscopically. And again, once it's out, you're great. But I would still say change the way you eat, change your lifestyle if you want to make sure that you don't ever get a polyp again. On the right-hand side is a typical colon cancer. And we call these apple core lesions. They're almost circumferential. They look like an apple that's been eaten all around. And this is bad. These have to be resected, and these, have a high chance of metastatic disease. And just a couple other microscopic pictures. The far left is normal colon, and you see those nice mucin cells. And if you look at them, they look similar to what we saw in the esophagus and the Barrett's, right? In the middle is a typical tubular adenoma. Most of it is the tubular adenoma from about maybe the 10 to 12 o'clock position is normal remnant of bowel mucosa. And then the rest of it, you see the nuclei are crowded, they're dark, they're elongated. They're somewhat architecturally irregular. Again, this is a nice small polyp taken out. That's it. And then on the right-hand side is an adenocarcinoma of the colon, which looks again similar to the adenocarcinoma of the esophagus. Again, you have necrosis, and you have your nuclei, which are crowded and high mitotic rate. So, that's something you don't want to get. Anyways, just before closing this pathology segment. As I said, these were for sporadic colon cancers. There are 2 conditions which I think people should know about, because people should know their histories. Familial hereditary non-polyposis colon cancer, which is also known as Lynch syndrome, which colon cancers occurs in people in their 40s, sometimes sometimes even a precursor polyp. And how people know about this is that if you say cancer runs in my family, people have endometrial cancer, breast cancer, esophageal cancer, stomach cancer, pancreatic cancer. You probably should ask your doctor if you should be screened for Lynch syndrome, because you may have the genetic makeup for Lynch syndrome, and you may need to have, colonoscopy or some other surveillance done sooner than recommended age 50. And then the familial adenomatous polyposis syndrome, people know about this. This is where your colon is studded with polyps, and you have a high incidence of colon cancer without intervention. So I will stop that screen sharing for there. And I try to say a lot in a brief period of time, but anyways, I think that, again, pathology from my end of the microscope is relevant in lifestyle, in any organ of the body. And anyways, those are just kind of 2 to highlight, to kind of, have people make the mind connection with the information, and anyways, hopefully be more empowered that way.
Yeah, it's fascinating, because the idea is to put you out of business as a pathologist, meaning,
right?
That's
that would be fine, right? If the whole world got better, that's okay with me.
That is fascinating. Julie wants to know, have you read Fiber Fueled?
I have. I think it's great. And I mean, there's a lot of good information. Definitely eat fiber. And, you don't even have to count. If you're plant-based, if you really are, you don't have to count your fiber, because it's in everything you eat.
Yeah, exactly. Exactly. Chef Yogi, what a great name, says invaluable PowerPoint presentation. Thank you. And Jessie says, I would love to see Dr. Rimmerman again. She's wonderful.
Thank you. Thank you.
Yeah. So people want to connect with you. I've posted the link to your website, and your Instagram. That's where you're most active, is Instagram?
Yes. Yes, definitely. Yes.
Yeah. Well, this was just really wonderful. I'm so happy to meet you.
Great. Yes, me too.
Maybe we can get everybody else on the block, because I know Jane had a neighbor of theirs on her show making gado gado. Maybe we just get your whole neighborhood on the show. Right. And like I said, a lot of people have said my husband should be on here too, because he sees patients, and he really would he like to be on? Is he plant-based now, or plant exclusive?
Oh, he's totally plant-based. Yeah, he is.
Hey, let's do it. I'm booking for December. It'd be a pleasure.
Yes. Well, thank you.
That was a wonderful presentation. Thank you so much, Dr.
Right.
Rimmerman.
Thank you. Thank you.
All right. And
All right,
thank you
take
for
care.
eating vegetables for breakfast, improving the efficacy
Yes.
with your continuous glucose monitor. I would
Yes,
love to talk to you more about that.
All right, good. Thank you.
Thank you. And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow an hour earlier at 10 a.m. because we always give Dr. McDougall extra time. He's going to be talking about one of his mentors, Dr. Walter Kempner, who he believes is the creator or the founder of diet therapy. He's going to specifically talk about the rice diet, and he's going to be joined by the new publisher of the Rice Diet Report, Lois Ann.